naturopath. We're back on the topic, talking about fish oil again, omega-3. So let's talk about DHA and EPA, the differences between them. So these are basically polyunsaturated fatty acids. They're very interesting when you have a look at the science behind EFAs, and like the benefits to the body are quite profound. So a good quality fish oil will contain usually large amounts of EPA and large amounts of DHA. So if we have a look at them both, they're considered to have quite long chains or quite long tails. I think 20 carbons long. It's quite a long kind of structure. For the EPA, DHA is about 22, I think, and the alpha linoleic acid is 18. It's considered a shorter chain fatty acid than the DHA and EPA. So the benefits, particularly DHA, we're looking at cognition. We're looking at 8%, I think between 7 or 8% of the brain structure is actually made from DHA. So people who take DHA regularly into the body tend to have a better neuronal function, better brain function, better cognitive function. Anxiety and depression are also aided by DHA. But the depression is particularly coming through on studies with the EPA, whereas the EPA tends to favor more the production of anti-inflammatory eicosanoids. So this is what I would recommend more for heart disease, for example, or diabetes, would be EPA. But yeah, cell membranes, all your cell membranes basically need both EPA and DHA. But they actually work together as a team, and you'll find that they have quite a significant effect on communicating, on allowing the immune system in particular to communicate, but also the endocrine system. So your hormones and immune function are very dependent on good levels of EPA and DHA. I've always found that when people have plenty of both of these in their diet, in terms of a good omega-3 supplement, they feel better, they sleep better, they think better, their memory's good. They also have a quicker wound healing, less chance of colds and flus, for example, especially if the fish oil is fortified with extra vitamin D. So you can see they're quite similar, but they have their subtle differences. But I've never been a fan of getting patients to take a supplement which is purely just EPA or purely DHA. You need to have them both together in a supplement for them to be effective. You're primarily going to get EPA, DHA from fish oil, from fish sources, from seafood sources. You can get it, as I mentioned in previous videos, from things like walnuts, but the conversion of the ALA to DHA and EPA is quite retarded. It's quite slow. It's not really highly effective, so it's not one I'd really recommend that you do, but rather cut to the chase and just take the fish oil. Think about inflammation, think about positive immune benefits, think about cognitive function, think about heart health, reduction on the risk of the three big ones: cancer, diabetes, and heart disease in particular. Thousands of studies are now showing that people who take omega-3 on a regular basis tend to suffer a lot less from chronic ill health than people who don't ever take them at all. But remember, the best bet is to eat food a few times per week that contains omega-3. All right, thanks for tuning in.